having that hope, even going to Kenyatta and being told that there is hope for her, it was a miracle on its own. And I was very grateful to God for that.
Recently, we had a major milestone where we were able to perform a highly advanced interventional procedure on a child, one of the patients that we follow up here at the Kenyatta National Hospital.
Shelvin was born on 14th of December 2010. We didn't know that she had an issue with the heart when she was born. We came to discover about the issue of the heart when she was about 5 years old. She had started school, and it was actually one of my in-laws who noticed that her heart was beating unusually fast.
I used to go to the hospital a lot because I wasn't eating. Often I would miss school and go to the hospital, stay home. I felt like I was being blocked from doing activities. I liked running. I wanted to engage myself in so much, but I couldn't because I got tired quickly and it brought a problem. I felt like I'm not getting that opportunity and it's just passing by. And I didn't want people to see me differently because of that. It just felt depressing and kind of hard.
Our patient was a 15-year-old child who had lived with a hole in the heart, which we call a ventricular septal defect. As you all do know, the heart has 4 chambers. We have the upper chambers and the lower chambers. And this baby had a defect in the lower chambers, what we call the ventricular septum. Usually that is an abnormal communication. It should not be there.
She didn't miss any milestone, and she was very active, really. I think the point that I really noticed, and I assumed, when she was breastfeeding, she would really not breastfeed a lot, like 2 minutes or 3 anaata. Kumbe she was getting tired, and I didn't know that she was getting tired. But overall, when she was growing up, angecheza arudi like nimechoka, then she stays in the house.
So what we did for this particular child is that we accessed the heart from the leg. Some people like to think of it as a keyhole procedure, where we accessed the heart using the big vessels in the leg, where we put a catheter in the lower vessels of the leg, and then we were able to track, because these vessels eventually drain into the heart, we're able to track and put our catheters into the right ventricle. And also we were able to track from the arterial side, and we're able to put our catheter into the left ventricle. And these catheters are special equipment. They're very fine, they're very thin, and at the tip you have the device lodged. And so the device then is placed very carefully on the defect, on the ventricular septal defect, and then it seals the defect. It's a highly advanced procedure, and one needs to be very careful because we do this under X-ray guidance.
The doctors were really, really kind and really calm. They assured me that I'll be okay. They talked to me, told me what's going to happen. And when the operation was there, I went. They gave me an injection and I fell asleep. And after that, I don't know what happened.
I was crying the whole time. The doctor kept telling me, it is well, it is okay. I don't remember his name, but he gave me some time to just relax, and then so that he can explain it to me.
The traditional approach has been open heart surgery, where someone goes and the surgeon cracks open the sternum, literally opens the chest, accesses the heart, cuts the heart, and sews the lesion. But with this new technique that we have been privileged to perform here at the Kenyatta National Hospital, this child, believe it or not, stayed in hospital only for a night, and she was discharged the following day. And we expect that this device that we left in the heart should stay there. She'll stay with it all, for the rest of her life. We do not expect any residual or any complication arising from this procedure.
In the future, I'm excited that my hole won't be a problem anymore. Like now I'll be able to do activities. I won't get as much sick. My immunity won't be that low. I'll just be okay. And now I'm excited when I go back to school, I'll have more time to ask the questions that I didn't understand in my exams, study, continue with the syllabus, finish school. Yeah.
It makes me feel proud that in Kenya we have doctors that can really do that. You know, we always think that with these issues we have to go to the country, but to actually have a hospital that it's open for watu wa chini and everyone. I feel that it's something that I'm very grateful for.
And that's great because it has really put us on the front line, in terms of our advanced, capacity as a team. We are probably leading in the region in as far as interventions and diagnostic cardiac procedures in children are concerned.